Hello everyone, Michael Ferrara with Ferrara Services, and I hope you're having a good day. Today I want to talk about Original Medicare, Part A, Part B, as well as go over Medicare Supplement Plans and Advantage Plans, the pros and cons to both. So with Part A and Part B, I want to go over what those deductibles are and what it can cost you if you are admitted to the hospital, as well as how a supplement plan and Advantage plan can prevent you from high out-of-pocket expenses. So let's get right into it. So Part A is your hospital insurance. Majority of the seniors when you turn 65 aren't going to pay anything, and you'll be automatically enrolled in Part A. If you're not automatically enrolled in Part A, you could pay a monthly premium up to $407 per month. Part B is going to be for your medical insurance, which is going to cover your doctors in and out of the hospital. Most people are going to pay Part B premiums of $104.90. The good news is this is not this is not changing for 2016. This will remain $104.90. Part B pays for all doctors, like I mentioned, in and out of the hospital. Part A, so inpatient hospital cost. If you have Original Medicare, just Part A and Part B, this pertains to you. So if you get admitted into the hospital, you're going to be responsible for the first $1,260 per benefit period. A benefit period is 60 days. So days 1 through 60, you're going to have zero coinsurance. That's pretty much going to cover your $1,260. Days 61 through 90, you're going to pay $315 per day for each benefit period. So if you're admitted into the hospital today and you're in the hospital for 60 days, you pay your $1,260 deductible. You leave the hospital, 60 days go by, you go back into the hospital, that deductible starts over, so you pay that $1,260 again. If you get admitted into the hospital before that 60 days, you stay on the same plan. So you just go to the next day. So days 61 through 90, you pay $315 per day. Days 91 through 150, you pay $630 per day, which is your lifetime reserve. With Medicare, you have 60 days of lifetime reserve. Once you use those lifetime reserve days, they go away. They no longer exist. You have one shot to use them. Days 151 and beyond, you're going to pay all the cost. Medicare is not set up for catastrophic events, not set up for any long-term hospital stays. So as you can see, if you're in the hospital for 150 days, you're going to have a Part A cost of $47,565 just for Part A. So let's look at Part A skilled nursing costs. What if you need skilled nursing help? Days 1 through 20, they're not going to cost you anything. And again, this is where benefit periods come into play, so 60 days. Days 21 to 100, you're going to pay $157.50 per day for each benefit period. Days 101 and beyond, you're going to be responsible for all the costs. So if you need skilled nursing for 100 days, it's going to cost you $15,750. Part B, you're going to have $147 a year deductible for 2015. Now that's important, that's a year. You pay that once for the year and then you're done. In 2016, that's going up to $166, which is a little bump. However, it's good news because the government was trying to get that deductible up to $232. So them getting it down to $166 is good news. After you meet that deductible, you're going to be responsible for 20% of the cost. Now, this is important to note that this is covering you for doctor visits, whether you go to the doctor office or you're in the hospital. This is paying for all doctors. Your doctor, every time he comes in your room, you're going to pay 20% of that. If you have surgery, you're going to pay 20% for your doctor, anesthesiologist. Any specialist in there, you're going to pay 20% of that bill. So you can see where Part B can start adding up to a lot of money. There are no ceilings. There's no max out of pocket. This can go as high as it can go. There's just no limit. It's not set up for long-term hospital stay. So how do you protect yourself from having these high costs, these max out of pocket, just completely unpredictable? You don't know how much it can cost you, because if something bad happens, it's a shot in the dark how much that you're going to walk out of the hospital owing. So you have two choices. You can picture yourself coming to a fork in the road. You go down one side of the road, you have your Medicare Supplement plans. If you go down the other side of the road, you have your Medicare Advantage plans. So what's the pros and cons to both these plans? Well, let's look at them. With Medicare Advantage plans, the pros to those plans is there are plans out there that have 0 monthly premiums. So you're not going to pay monthly for these plans. Part D is going to be included in most of these plans. You're going to get a free gym membership. So what are the cons of these plans? You're going to have copays. You're going to have high out-of-pocket expenses. Your max out-of-pocket could be $2,900 to $6,700 per year, which is set by the federal government, plus co-insurance. You're going to be on limited networks. You're going to have to worry about healthcare reform. You're going to be locked into these plans for 1 year. Medicare is no longer your insurance company. Medicare pays the insurance company, which we have no idea how much Medicare pays these companies, but they pay these companies $300, $500, $800 a month to run your insurance. So Medicare is no longer your insurance carrier. They pay the private insurance company, which runs these Advantage plans, to administer and run your insurance program. So with the Advantage plan, you still have the unknown of how much is this going to cost you, because you don't know. You could be paying $0 a month, but if you need to use these plans, you just don't know how much it can cost. It can be thousands of dollars that you may not be ready for. So you kind of have that unknown. So let's look at the supplement plans. What's the pros and cons of the supplement plans? We can almost take what we just showed you with the Advantage plans and just flip them around. So what's the cons to the supplement plans? You're going to have a monthly premium. Part D is not going to be included, and you are not going to get a free gym membership. So what are the pros? You're going to have no copays, no high out-of-pocket expenses. You don't have to worry about $2,900 to $6,700 a year. You have no co-insurance. You don't have to worry about networks. You go to any doctor anywhere, as long as they accept Medicare, your supplement plan will pay. You don't have to worry about healthcare reform. You're not locked into these plans. You can change these plans anytime throughout the year. Plans are designed by the federal government, and they're all standardized. Medicare is your insurance company. So with the supplement plan, you don't have the unexpected cost. You pay your monthly premium, and that's all you pay. So if you get admitted into the hospital, you don't have to worry about, oh my goodness, how many thousands of dollars is this going to cost me? You just have to worry about paying your monthly premium. So there's no surprise with the supplement plan. You pay your monthly premium, and that's it. So Medicare supplement plans. All plans are identical and are standardized by the federal government. Plans are offered A through N, which you can see on the 2016 Medicare Handbook, which is on page 100. This changes every year. Each company may charge different premiums for the same exact plan, which is on page 100 of your 2016 Medicare Handbook, which I've copied and pasted here for you, which specifically says in your book, if you turn to that page, it says, how do I compare Medigap policies? It says different insurance companies may charge different premiums for the same exact policy. What does that mean? Well, here are your plans. Plans A through N, which the federal government designed these plans. So if you call any insurance carrier and ask them to send you their plans, they're going to send you these plans. It doesn't matter the name. You can put any name of any company you want on top of these plans. There's still these plans. The XYZ carrier isn't your insurance company. Medicare is your insurance company. They coordinate with the supplement plan to cover all the plans. So if Medicare pays, that supplement plan has to pay its share of the plan. That's all there is to it. So let's just look real quick on how a supplement plan can work on that example we looked at earlier. So Part A. So you get admitted into the hospital. As we know with Part A, you have a $1,260 a year or benefit period deductible. So if we look at Plan F, which is right here, it's going to pay that deductible for you. So you pay nothing. Let's look at Plan G. It's going to pay that deductible for you. You pay nothing. So now let's go to co-insurance. Days 1 through 60, Part A pays nothing, so you don't have to worry about it. Days 61 through 90, Part A pays you would have to pay $315 per day. Plan F, you pay nothing. Plan G, you also pay nothing. Days 91 through 150, this is your lifetime reserve, is $630 per day. You don't have to worry about it because you're not going to pay anything with Plan F or Plan G, for a total of $47,565 that you would have to pay with Part A, but with Plan F and Plan G, you again pay nothing. Now also keep in mind, with the supplement plan, you're going to get 365 additional days of coverage that you do not get with Original Medicare. So let's look at Part B. How are we going to pay these doctors? Well, Part B is $147 a year deductible for 2015, and in 2016 it's $166. So with Plan F, that plan is going to pay that deductible for you at a higher premium, which we'll just call a convenience fee. They'll pay that for you, so you don't pay anything. Plan G, you're going to pay the $147 in 2015 and $166 in 2016, but you're also going to pay a lower monthly premium for that plan. So after your deductible is met, we're going to look at Part B coinsurance. Part B is, we know that you would be responsible for 20%. With Plan F and Plan G, you're going to pay nothing. Absolutely nothing. So looking at the example of total out-of-pocket with Part A and Part B only, Original Medicare, it's just unknown. You could have a bill of $47,565 plus your Part B, premium, whatever that is, plus skilled nursing. It's just too unknown. You don't know. You can owe thousands of dollars. You just can't predict for that. You can't save for it. It's just too unknown. So if you add a supplement plan, also known as Medigap plans, you can budget for that. You can predict it, because all you're going to pay is your monthly premium, and then after that, there's no unexpected surprises like I got sick and I went into the hospital. Now I have a $20,000-$30,000 bill. You don't have to worry about that. With your Medicare Advantage plans, you still have the unknown. You could pay $0 one month, and then the next month you can get ill or need surgery and go into the hospital and have a $6,000 bill. You just don't know. You can't predict it. You can't budget for it. With a Medigap plan, you can budget those plans, because again, all you're responsible for is your monthly premium, your Part B deductible. Then after that, everything's covered at 100%. So I want to thank you for watching. Hopefully I made this a little bit clearer for you. I know it's hard with a little video without being, in person, but we kind of went over that little fork in the road where you can go with the Medicare Supplement Plan or a Medicare Advantage Plan to supplement Original Medicare to prevent really high out-of-pocket expenses and prevent you from being bankrupt by Original Medicare. I appreciate your time. Again, my name is Michael Ferrara. If I could be of help, please give me a call or send me an email. I'll be happy to answer any questions you may have. But I appreciate you, I appreciate your time, and I hope you have a great day. Thank you so much.